be the last day that I'm reviewing for NCLEX. I'm gonna be taking it 4 days from now, and I don't think I'm gonna be able to review tomorrow. And yeah, so I hope I will pass. So now I'm here reviewing about, I'm using more clinic reviews and boot camp for Cubans, and I think I did all the questions except for the case study. I didn't have the time before my account expired, so yeah, there were a lot of case study that I wasn't able to answer, but I hope, yeah, I'll be able to pass. So I'm here right now, and more coming video 2, which is about alcoholism, and I'm here overdose and withdrawal symptoms of illegal drugs or abused substances. So for uppers, we can classify abused drugs into 2. We have the upper and the downer. For the downer, there are probably about 135 drugs. However, for uppers, we have 5 at least. So we have caffeine, cocaine, PSP, LSD, hallucinogens, and we have methamphetamines and Adderall. So the action of uppers is, of course, to stimulate the central nervous system, and our body also responds upway. Tachycardia, tachypnea, everything's going up. So we have here seizure precautions, and what else? Hyperflexia plus 3 plus 4, diarrhea or borborygmy, and downer. So except for those 5 drugs, everything else are downers. So the body system goes down. Respiratory arrest, respiratory depression, arrest, constipated, lethargy. So in questions regarding drugs or illegal substances, first we have to ask if it's an upper or a downer, and then if it's an overdose or a withdrawal. So the thing with overdose is, of course, it goes with what the action action of the drug. So if it's an upper overdose, everything goes up. However, if it's an upper withdrawal, so withdrawal is going to be the opposite. So an opposite for upper, of course, downer. So the effects on the body will go down for an upper withdrawal. So example, if a patient has, let's go first with overdose. So if a patient is overdosed with caffeine, so overdose, same reaction with its classifications, everything goes up, and the worst would be seizure, kinda hyperreflection. And example, if we have caffeine withdrawal, so it's going to be the opposite. So it means you're not getting enough of the substance that you're addicted to. So the effect would be the opposite. So you're going to be down, you're going to be lethargic, constipated, and the worst would be respiratory depression. So also, how about for cocaine withdrawal? What could be the antidote? Cocaine and other opioids would be Narcan or naloxone. Okay, so now we go to alcohol withdrawal syndrome. So usually it happens after 24 hours since the last dose of alcohol, and it happens to all alcoholic. And alcohol withdrawal syndrome is not life-threatening. We also have delirium tremens, which occurs after 72 hours from the last dose of alcohol, and it happens to 20% of alcoholics. This is life-threatening the self and to others. So the most tested drugs in NCLEX, psychiatric drugs, insulin, anticoagulant, digitalis, and aminoglycosides. Also have anti-hypertension, pain meds, and OB meds. So now tackle drugs. Aminoglycosides, top 5 most tested drugs. Amine old myosin. So when you think of aminoglycosides, think of amine old myosin. What does that mean? So amine old myosin treats serious resistant life-threatening gram-negative infection. So these are really strong antibiotics, like strong. And ends in mycin. So the drugs under this category ends in mycin, except throw in the middle. So you have thromycin and mycin. Be careful because there are other drugs that except they. So there are other drugs that I have to erase that. So the drugs under this category ends in mycin. And be careful because there are other drugs that has thromycin that ends in thromycin, they are not included in this classification of drugs. So you have to throw those mycin out of aminoglycosides category. So the toxic effect one. So with that, amino old mycin. So think of mice. Mice have like Mickey Mouse, Minnie Mouse. They have big ears. So it's toxic effect one affects ears. It's ototoxicity. And then the second one is the ear of the mouse. What can you think of new? You can think of the number 8. The 2 ears. Like number 8. And you can think of, I said number 8. When you think of the shape of the ear, it's like the shape of your kidney. Not the number 8. It's like the kidney, so it's nephrotoxicity. Kidney function creatinine. So to check for the kidney function, you have to check the creatinine. 24 creatinine clearance is better than serum creatinine. That's all the song. Tarin sa yakap mo, mga sa huli, palagi pipiliin ko maging sa'yo, ulit-ulitin man. Nais kong malaman mo, iyoko palagi. Balikan mo ng hirap luhat lahat. Ikaw ang paborito kong desisyonan. Pag napaligiran ang ingay at ang gulo, di ko pagpapalit ngiti mo sa mundo. Eto na tayo sa huli, palagi babalik pa rin sa yakap mo, hanggang sa huli, palagi pipiliin kong maging sa'yo. Let's go back. So don't forget aminoglycoside, old mycin, vancomycin, strong for gram negative, and we have to be cautioned about ototoxicity and nephrotoxicity, and the best way to check for kidney function is 24 hours creatinine clearance, better than serum creatinine. It's toxic to cranial number 8. So this is where I got number 8. And given every 8 hours, given IM or IV. So except for PO, those IV and IM meds may cause hepatic encephalopathy pre-op bowel surgery. So for bowel surgeries, aminoglycosides are also used. So who can clean my bowel? You can. neomycin and kanamycin. Neomycin and kanamycin. So, for drugs with narrow therapeutic window, we have to have tap, throw, administration, and peak. Throw, administration, and peak. So the throw, it's always 30 minutes before administration. So when you check for tap, throw, it's 30 minutes before administration. So if the drug is to be given at 8 a.m., so you have to check for throw at 7:30 a.m. So the peak changes. So it depends on the route of the drug. So for sublingual, peak is 5 to 10 minutes after administration. It's very fast. We have IV, 15 to 30 minutes. IM, 30 to 60 minutes. Sub-Q depends on the insulin. And PO, we don't test. So again, for sublingual, 10 to 15, IV 15 to 30, IM 30 to 60, sub-Q, insulin depends on the insulin, and PO we don't test. Again, sublingual 15 to 30, sublingual 10 to 15, sublingual 13, 10 to 15, I'm so sleepy. IV 15 to 30, IM 30 to 60, sub-Q depends on the insulin, and PO we don't